Hi, Dr. Henry. As I'm sure you know by now, people love specifics, and I think hearing anecdotes are helpful in getting the message across. So I just want to go back to an example you briefly touched on earlier about, I think it was the father of the bride. Just wondering, when was that wedding and how many people were affected by the virus as a result?
Yeah, so that wasn't in BC. That's a report that's been in the media. That was not in the media, in the literature. It's one of the examples that we've come to understand. So this virus is one that we now call. It's not like influenza. With influenza, the incubation period is very short. People get sick within 1 to 3 days of being exposed, and we can be infectious to others in that period of time. So it moves through populations really quickly, and it affects everybody. With this virus, most people, the incubation period is longer. It can be up to 2 weeks. Most people get sick about day 5, day 7 after they've been exposed. So we have a period of time where we can take people out of harm's way, essentially, and monitor them. We don't have any drugs right now or medications that help us stop you from getting sick, but we can remove you from those situations where you might be infecting others. But we've also learned that some people can transmit this virus before they realize they're sick. So that's where we get into that challenging period where we want to make sure we're not in group situations with large numbers of people indoors, crowded, close to each other, sharing food and drinks, talking, kissing loudly, kissing, those sorts of things where we know we can spread this virus very quickly. So this was a wedding that took place in the U.S. There was over 200 people who attended, and I believe there was something like 100 and some who became ill, including some people who died. And the thought was, well, if it hadn't been the father of the bride, if it had just been a guest, maybe it wouldn't have spread that much. But the challenge we have is those opportunities for us unknowingly to bring it into a situation where we're in close contact with people and can spread it. Our example I used last week was the tragedy of a woman in her 80s who went to a very small party in a home in Metro Vancouver where there were under 10 people there, and 3/4 of them became ill, and she died, unfortunately. So we've seen lots of those little clusters or what we call super spreader events where the situation is what allows it to be spread to so many people. That's why I get so fussed about keeping our numbers small. We had a church outbreak in the interior where there were less than 50 people at the service. Somebody, unfortunately, was unknowingly shedding the virus. They had a lot of singing, and some people at that church service became ill, even though they were ostensibly trying to keep their distance and making sure that they weren't having tea afterwards and things like that. But it can happen. So that's why it's so important for all of us to reduce those situations. We've heard about the spin class in Ontario where 60-some people were infected. We know there's been spin classes here in BC where we've had 20 or 30 people being infected. Right now, spin classes in Metro Vancouver are dangerous. We should not be doing those things. We need to find other ways. I should say indoor spin classes. The outdoor ones, we haven't seen transmission. But those are the types of situations where we need to pay attention to how much virus is in the community and what types of risks we're potentially exposing ourselves to. And, I have to say I've not been to a spin class myself, but we're in bikes, people are sweating, I have seen them. And, there's usually loud music and you're in an indoor space and people are breathing heavily. The instructor is shouting instructions. Right now, in Metro Vancouver, that is dangerous. We should not be doing that. Let's find other ways of keeping our gyms open, of having exercise that people need for their health and well-being.
Do you have a follow-up, Tanya?
Yes, please. So given that, you just said how dangerous they are, why aren't those places perhaps going to be shut down. And going back to what you mentioned about the church, and you mentioned a few minutes ago about family gatherings, I think it was when talking about the Fraser Valley at some events and weddings where people respected the limit of 50 people or fewer. But if the spread is still happening, I mean, is there a consideration, and when would that be, to limit that size further? And going back to the gyms, and what would be the next step to shut those places down as we head into the cooler weather? And an answer in French, please. Thank you.
So, the overall guidance that we have addresses all of those situations. And what we've said is, we can't expect there to be 0 cases because we know this virus is spreading. What we need to do, and what we all need to work together to do, is minimize the number of people that we're spreading it to, and make sure that we're doing everything we can to protect those people who we know are more likely to end up in hospital or to die from this virus. So much of it depends on our own personal situation and the elders and seniors in particular in our lives. But yes, local public health did take action in each of those situations I was talking about to address the individual situations, the individual business, the individual gym, and those are the types of things that we are putting out here so people understand. You need to understand the risks in the situations you're going into. There are many other situations, and local public health is addressing each of those under the provincial framework that we have.
I was going to say, Dr. Henry, in some years I've done hundreds of spin classes, but this year, 0. No spinning this year. And I think there's good reason for that. And I think with respect to the question of gatherings, the maximum in a private residence is 6 guests. And if you're in Metro Vancouver, you should seriously consider whether 6 is appropriate. And that's because it's different in people's homes. And so when we talk about weddings and other gatherings, frequently there are parties associated with that both before and after, as we know. And it's in those events and multiple of those events that we've seen transmission in recent weeks. So, the message is the same. No parties, don't throw them.